Good morning, everybody. My name is Mark Walsh, and welcome to the webinar about the Northeast North Cumbria subnational secure data environment. Just a few housekeeping things first. We will be recording the session. Please, can you ensure your speakers are muted while we're presenting? We will be having a panel question and answer session at the end, approximately 15 minutes. If you have got any questions, if you could put them in the chat, or if you could raise your hand during the course of the webinar, and we will answer questions at the end, not throughout the presentation. If there are any unanswered questions in the chat, we will answer those subsequent to the presentation. So my name's, in terms of introductions first, my name's Mark Walsh. I am the Northeast and North Cumbria SDE Programme Director. I work for Health Innovation Northeast and North Cumbria, which was previously the Academic Health Science Network. So we have additional speakers, so we'll do those in order. So Mark Dornan first.
So I'm Mark Dorner, I'm a GP, and I'm one of the Chief Clinical Informatics Officers for the commissioning system for the health and care system called the Integrated Care Trust, Integrated Care System, the ICS. So as I say, I'm a GP, but I'll talk a little bit some of the overview of the programme when we get to my slot. I think we're going to Vicky next.
Thanks, Mark. Hi, I'm Vicky Campbell-Malloy. I'm a programme lead within NEX, and I'll be talking about the service and the technical background to the SDE, so the kind of platform of the wraparound service. I'll hand over to Chris.
Hi, I'm Chris Plummer. I'm a cardiologist, and I'm the CCIO in Newcastle. I'm going to talk about the SDE and how we see it from a clinical researcher perspective.
So just as a bit of a start off, we have just an initial Slido question we'd like some responses to next. So we have the question on the Slido. We've got the barcode there and the details for joining. And we're just interested in kind of current knowledge about secure data environments, just understanding kind of your current level of understanding. Obviously, there's 5 different gauges there. If everybody could just look to fill those in, and we'll leave 10 seconds or so just while people are doing that. It's really interesting. Obviously, responses are still coming in. We've got 50 at the moment, so do keep input into those. And it looks as though in general people are kind of in the middle. Obviously, the general ones. So hopefully by the end of the presentation, kind of things are more moved over to the right. So yeah, do keep inputting into that, and we'll move on to the slides now. So I'm going to give a strategic overview of the SDE program development nationally and locally. So on to the next slide, please. So the program developed really from the Ben Goldacre review back in April 2022. There'd been a lot of work around trusted research environments leading up to this point, both locally and nationally. And in Ben Goldacre's report in April 2022, he talked about how we can make much better use of data for research and development with appropriate safeguards and governance. And he talked in depth about the complexity and challenges for researchers in accessing and using health and care data for research and development, and how we could start to overcome these by reducing the burden on the number of data transaction and also the amount of approvals in place. So basically, still having the safeguards and governance, but starting to kind of balance things out so we could provide better access to data. This moved on into October last year, 2023, where we had an update to what's called the data access policy, which was open to consultation. And this policy again will be updated during the course of this year. And this policy gave a clear message to move away from data sharing a data sharing model where we distribute data for research and development to providing one source of data access, and this is through the national network of secure data environments, in effect bringing researchers to the data as opposed to distributing data out. Next slide, please. This is the map of how the network looks. So in December 2022, Northeast and North Cumbria was announced as one of 11 sub-regional secure data environments. And this will be also supplemented by one national secure data environment. And each of these regional data environments will provide a common data catalog and data sets as part of a national network. All of the network will work to common standards and allow access to data catalogs and data sets from across the national network, in addition to national data sets which will be offered through the national SDE. So we're starting to bring a kind of a common model of access to data working across the 11 SDEs and supplemented by the national. Obviously, it was really good that Northeast and North Cumbria was recognised within this. And this gives a huge opportunity for the region in terms of life sciences and progressing research. But what we really need to think about, and what we've been considering certainly as a programme team and as a wider community, and be really interested in views from this webinar as well, is really what sets us apart as a region. So we'll talk about how this network will be accessed on a national basis by individual researchers, and what we really need to think for the Northeast and North Cumbria, what has set us apart. And the key thing there is the data, and obviously what data we can hold and what data we can provide as part of our subnational secure data environment. And just thinking about the kind of demographics of the Northeast and North Cumbria in general, our challenges around healthcare and inequalities, etc. What will set us apart in terms of data, and again, would be really interested if there's any specific data sets which you can help identify, which we can include within our offer within the secure data environment network. And again, if you could use the chat for that purpose. Next slide, please. Within the national secure data environment network, the aim is to develop what's called a common front door, and this is what's using the HDR UK Innovation Gateway, which is currently used for cohort searching, etc. Again, nationally, but the ambition is to develop that to provide a common front door. So anybody who wants to get access to the national SDE network has got a common look and feel, and then they can browse data catalogs. Again, they can do cohort searching, but also what looks like a common access method. Within NENC, we're working as part of the national network and with NHS England to ensure we're working to the right standards in order to facilitate that. Next slide, please. As I mentioned, we're now one of 11 SDEs, which is obviously excellent news. We received £8 million funding for the Northeast and North Cumbria. That was confirmed in August 2022. This was slightly later than planned, but we have been doing work ahead of that. We have a technical platform in place now, which Vicky's going to talk about, and that's hosted by our North of England Commission Support Unit, NEX. We've been doing a lot of work on governance and looking at how we can reduce that complexity around information governance, around our approvals, around our data access, but ensuring we have kind of the right safeguards and governance in place as well, but really just starting to reduce that complexity down, which Mark and Chris will talk in more detail around. And we've been doing lots of awareness raising, communications and engagement. We have quite a vibrant public group now. Public involvement's inherent in the programme nationally and locally. We've got a very active public group who we've also got members of that active within our governance network as well. We need to work as part of the national network towards developing a common commercial framework, so what the pricing model would look like, and we'll be doing work over the coming months around that. And we have got some initial projects already started. We're very keen to test our technical infrastructure using governance and data access protocols, which are in place now. And Chris, in his section of the presentation, will talk a little bit more about that as well. Next slide, please. So we're on the national map within North East and North Cumbria, which provides a huge opportunity. And what we can do with our SNSDE is bring people together to look at common data and common questions, research questions from a range of different sectors, including our 6 universities and the specialist knowledge within our 6 universities and skills from within there. And also, we can provide access, as we've said, from our researchers and specialists from across the wider community across England, and potentially further afield as well. The big gain really is kind of, I see it around what we're doing through to March 2025 is the transformation around reducing the complexity around data access, getting back to Ben Goldacre's report, while ensuring we have appropriate governance and frameworks. And this will really help drive forward research and innovation for healthcare in our region. So at that point, I'm going to hand over to Dr. Mark Dornan to take the presentation on.
Thanks so much, Mark, and just a huge thank you for all of you joining today. As a clinician, I'm so grateful for all the research that happens to try and help us do better things for our patients, but also we know that it brings a huge amount of resource and money into the region, and creates many jobs and does many great things for our region and helping us be able to influence what happens for our public. So a huge thank you. Next slide. So I'm going to talk a little bit about sort of the overview, and then Chris is going to go on to the detail in a second. I don't know if the slide will move on, whoever's controlling it. Thank you. We just want to give a quick bit of an overview about some of the practicalities and making sure people understand that a secure data environment is very much an environment. It is all about trying to have an online cloud-based access for people to come and do their research, and we hope that this new way will make health data much more accessible, but it is a key point that data is going to be made accessible, not given. So that big black cross is a really important point, that we're no longer going to be taking data and moving it to other places. It's just an environment we're creating, and we think that has lots of opportunities. So we'll explore that on the next slide. We hope that this will become the default place for people to access their health and care data, so we can streamline it for the region. We hope that this will provide a single gateway to access and analyze data, and we know that at the moment the complex system does make it really, really challenging. But as I said before, the data remains within the environment, and we can grant virtual secure access, which we hope will give the public a lot more confidence in how we're managing this. And obviously key to giving confidence for the public is that accreditation, and making sure that as we do this whole system change, that we're then able to make sure that all of what we do applies to the national security and confidentiality standards, and that we can hopefully again continue to build that confidence and allow more research to happen in our region. Our next slide then, please. So as we say, we're hoping that this will bring more collaboration, and that more people will be able to do things, particularly as we think about how we link those data sets and be able to enable a whole pathway to be visible in this environment, and allow people new ways of seeing that information. A key point that we're going to talk a little bit about is the approval, and we know that that can be really complex at the moment, as you have to get many data sharing agreements, and we're really hoping that this will help you as researchers, and if you're involved as being a data controller, we'll help yourselves as well. And as I say, we're hoping that by having this environment, the data will come to you and be in a much more usable form. So the next slide starts to go into a little bit more detail about how it works for the researcher. We're hoping that this enables people to be able to find the data much easier, to be really clear who the data controllers are, and that the information governance process becomes much clearer with clear sort of forms and protocols that we can then follow. Obviously, we want to make it as really easy as possible for our data controllers. As a GP, we get many different requests, but every provider has the same issue, and we know that there's a real need to standardize process, how requests are handled, and this process, this new way of doing things, makes the whole thing much easier for us as data controllers, but also much safer for the public and much more secure. So hopefully that enables the public to have more visibility about what projects are taking place, how their data is being used, what the safeguards are, and give confidence to more people to not have concerns about opting in, and hopefully also they can be involved in the way we make our decision making. You'll see there we have 380 data controllers at the moment, and that's adding up your GP practices and your foundation trusts, and we hope that by this change it will change the problems that we have, because we know that at the moment getting that data approved and the information governance improvement in place can slow down the rate we can progress, and we hope that this will change. So we want to think our next slide then about what the future is going to be. So by March 2025, we're hoping to have a number of these parts in place, and we're hoping many of them will come much earlier than that. So if we start with the Data Access Committee, this single way of trying to get approval for projects and trying to make sure that everything does meet the national confidentiality, the AIG processes, and that we then are able to have on it lots of different representatives from different parts of our communities, whether it's data controllers or a variety of other partners. And we'll talk about that in a bit more. But I guess the key thing here is that we a single approvals process. That Data Access Committee will then enable the secure data environment to grow. We're hoping that this single platform grows a catalogue of the opportunities that are out there, but obviously gives confidence to the public that all of that data is anonymised, pseudonymized, and that we can have the appropriate level of access to that data for the research that's being undertaken. And obviously that requires then this single data repository, and trying to make sure that we can then make sure that the persistent data that we have in this environment can gradually grow, and as I say, as we work with our data controllers to enable that to happen. If we just click to the next part, hopefully that means then that for researchers, we will be able to have a single proposal route using standard forms, and for the public, as we said before, hopefully they can be more involved and be more transparent about what we're doing, and give confidence for those that perhaps had concerns and didn't want their data sharing for research purposes in the past. But we also hope that the blocks that we've had with many of us as data controllers being very busy with our day jobs, that hopefully this process manages in a way that frees up and expedites that data being available for research. We wanted to focus a little bit more about each of those three areas, and starting off with the Data Access Committee. This will include people that are currently controlling the data, because obviously they have a legal responsibility to make sure that this all flows properly. We're wanting to ensure that members of the public can give confidence to this process, but obviously we'll need professional experts who are involved in research, and those that are using this to be involved as well. So hoping that that much broader community will enable us to get confidence in the way that we sign up and approve the research that's happening. So work on this is already underway, and we're hoping to implement that hopefully by the end of this year, and certainly before 2025. Obviously, fundamental to anything happening is then setting up of the data repository, and we're going to hear a bit more about that later on. And a lot of this is working on the legal basis of this section 251, and we can talk more about that. But this legal basis allows us to do lots of different things that this data repository will then make sure that we're giving confidence to all of those data controllers that the data is going to make sure it is being held safely and in a way that meets our various different regulations. Last slide, and that's hopefully me handing over to Vicky, if that's okay.
Yeah, thank you, Mark. I think I've got control of the screen now. Perfect, thank you very much. So yeah, I'm going to provide an overview of the SDE service. This is kind of made up of a couple of different components. The project support service, which is going to be that user front door that Mark talked about, the technical platform, and the data flows that are going to form part of that repository. So for those of you that don't know, Nex is one of the partners working to develop the NECS and SDE, and we're kind of leading on these parts of the project in conjunction with the wider team. We provide support services to users across health and care, and we've got a number of specialists in different areas. So kind of our data and digital development teams, we've got technical architects, data engineers and developers, governance experts, and kind of primary data quality experts as well. So we've got analytical and BI teams, as well as a research and evidence team, and we're kind of wanting to draw on the expertise that we've got to develop our NEG service offering to make it the best port of call for users as possible. So first, kind of moving on to the project support service. This is how users will interact in the first instance with the NENCS and SDE. It'll be the entry point for researchers, and it'll be able to offer advice on data availability, ethics and governance, as well as facilitating access to the technical platform. It's going to help us manage the project flow for the NENCS and SDE to ensure we've got capacity to support our pipeline of projects and that we're kind of generating new work as an asset for the region. It'll provide a consistent approach experience for users so they know what to expect, and there's that consistent training kind of access to know what things are going to look like. It'll also provide the processes in place for assurance for data controllers and the public, which is really important so that they know that their data is being handled in a proper manner and in line with principles such as the 5 safes, which I'll mention later. And it will hopefully simplify things by being that kind of single point of entry for research in the east and North Cumbria, and facilitate access to data via a published data catalogue, which will then show us when we've got that data repository what data is available there for researchers to use. So in these slides, kind of as Mark and Mark have both touched on, I'm talking about the future state here. So up until March 2025, as part of the programme, we are developing the kind of protocols and principles and putting those in place. While we're working with some pilot projects at the moment, we are kind of working on a kind of project by project basis, so having to agree those data flows and put in arrangements specifically for those. That isn't a longer term ambition, but it does mean we can still hopefully provide some support to projects in the meantime. So just on the next slide here is a bit of a high level journey that we expect researchers to cover. We have already engaged with representatives from each of the region's universities to talk through the approach and shared some draft documentation for comment. As part of the national programme, we're obviously part of as well. We're working with other SNSDs to align and use best practice where applicable. So at the very start, we can see we've got a scoping phase there. Users would expect would approach the SNSDE. That may be part of a feasibility for a study to check if there's relevant cohorts, or to provide costs and technical information for a funding bid, or what data is available. If funding is already in place, that's great. We'll kind of start work there to maybe develop some detailed data specifications and data flows for a project. Once we've got an idea of what the project is, what they need, we'll start a readiness phase there, and that will include the development of those governance documentation that we've talked about, support with ethics where applicable, and working to complete a formal application form to the Data Access Committee. So as touched upon, to get approval to use data from the NENCS and SDE, that's going to will constitute a Data Access Committee, and they will kind of pass that approval or kind of make that recommendation that projects are safe and kind of able to have access to data. Projects are going to have to demonstrate that they comply with principles such as data minimization, have ethics approval, as I mentioned, where necessary, and have that legal basis established. So the project support service is really there as a support and as a wraparound to work with the researcher and the researcher teams to pull this information together. And we can provide SME expertise in some of the areas I've mentioned, so ethics or data consultancy, linked to that wider service offer to really help with that, and hopefully help speed the process up and streamline and try and make it simpler for researchers, because we know at the moment it can be quite complex and take quite a long time to get access to data. If the project meets those prerequisites, that application I've mentioned will be presented to the Data Access Committee for approval, and if that approval is given, a workspace or a dedicated workspace will be set up for the projects, and the relevant data sets will be onboarded. Users will have to complete a user form, so agreeing to abide by SDE principles, so they kind of can't remove data. We've got to make sure we're kind of not doing anything that we shouldn't be, which goes against the secure data environment. And when that research is completed, we'll move to a project closure process and kind of look at archiving, obviously in line with any sort of requirements of the funding or project. As you'd expect, there will be some prerequisites or some things that we know we need to expect from an organisation and individual basis before users can access the SNSDE. So that's on top of those, the kind of user form, sort of signing up to those principles. We also need to align to a national direction, but also by doing this, it's also going to help us gain trust from the public and data controllers by demonstrating that the people who are accessing this data, that they're given a kind of safe to use that. There will be a requirement for organisations to be either DSPT, ISO 2701 compliant, or a locally agreed equivalent to access that NHS data. As I mentioned, we're keen to work with universities, so we do want to build strong links with research offices and make sure prospective users have engaged with them, so the whole process is kind of joined up and we kind of aren't creating any additional silos or complications by doing this. We're also looking to establish safe researcher training. So this is going to support cross S&E projects as we kind of go forward. We know that NHS England are looking to develop a researcher passport scheme at a national level, but while that's been agreed, we're looking at options to provide that locally. So just to make sure that researchers kind of know, and we've got that confidence again from the public that the kind of people are safe to access the data. I'll just touch then from a technical point of view. So this is around the platform that's going to be used to access the data. The SNSD in NENC is actually based on an Axiom platform, which Nexa developed. It's a cloud-based data access platform that provides individual data access environments for users and building it on infrastructure that Nexa already had in place. And it was born back in the pandemic out of the need to share data across different health and care partners when that proved difficult just due to different infrastructure in the past. So kind of Axiom, the development around that was born out of that. It also tied in really neatly with the timing, kind of as Mark mentioned, some of those national strategy. So things like the Data Saves Lives and the review from Ben Goldacre, it kind of ties in with that around kind of researchers going to the data rather than the data being distributed across different places. So Axiom provides health and care data for analysis, in evaluation in a secure data environment, and satisfies the ONS 5 safes. So they're principles which are now best practice in terms of data protection and access to data. The design of Axiom is based on a trusted research environment or tree, which some of you may kind of have come across before, and also by research from the UK's Turing Institute, alongside our 10 years of data management experience kind of processing NHS data. For that reason, kind of the current requirements that NHS England have set out for these subnational secure data environments, we meet those, but we know there kind of may be future requirements in the future. I won't go into too much detail on the technical part, but I'll kind of add a little bit to hopefully to reassure users of kind of what that experience would look like. So the SNSD will be hosted in Microsoft Azure and access will be via a virtual desktop. So it will look really similar to a Windows desktop that you're used to working with. It'll provide a range of tooling, so including things like Office, SQL, as well as Python, R, and Visual Studio. There's a GitHub-like environment where code can be shared and other tooling can be added, kind of providing it kind of meets some sort of the review and that it's safe to use, and also on a licensing basis. So kind of if things are free to use, following that, we could put those in there, but if there's a license, we may need to look at that. There will also be a data catalogue sat within the SNSD, and that will allow users to review what data will be available, as well as providing more detailed metadata around the information in those flows, so kind of frequency, maybe when last updated, any data quality issues that people would want to be aware of. And I think, as I've mentioned, it meets those secure data environment requirements. As you'd expect, the security is really closely managed. Access is kind of via multi-factor authentication, which can also be geo-restricted. So it's available from the UK only, and we can add further restrictions if required by data controllers. An airlock will prevent files from being exported, so they go into a specific file sharing location, and they've got to be reviewed and approved by someone, so that small number suppression, for example, is applied before they can be shared out. So we're really trying to take that seriously and put those extra steps in place to keep the data safe. Behind that, and to support and to make sure that users are behaving in the way we expect, there's also kind of detailed monitoring and auditing which is going to be collected, and again that forms part of that accreditation piece. Just finally, on the technical infrastructure bit, there's obviously those accreditation piece that I mentioned. We know that there's going to be further development that's going to be required as part of this national accreditation piece. So there's other work we're going to be undertaking. This is going to include onboarding of trust data that I'll touch on shortly. We're exploring the addition of multimodal data capability, so things like imaging, which we know will be important for projects going forward. As Mark mentioned, it's going to have integration with the HDR Innovation Gateway, so that's going to be the national front door, but this will also be supported by our kind of own local front door via that NENC SNSD data catalogue. There's also work underway at a national level to look at agreed formats for OMOP standardisation, so to support cross SNSD projects and really try and bring that standardisation into some of those data sets. And lastly, I'm just mentioning on there is the possibility of collaboration with Yorkshire and Cumbria. Different areas have got different aspects. So NENC is actually, NHS England, the funding they've given is one of 7 invested builds. So not all regions have got funding to have an infrastructure build. So we're fortunate in that, but that may mean that other SNSDs might want to collaborate just on that use of that architecture as well, which would again put NENC in a really strong position. Finally, just on the data flows, we know they're going to be a really key part to the success of the SNSTE. Next, it's kind of with its different hat working on behalf of the ICBs, already processes a wide range of data. So we provide data management services to kind of over 40% of ICBs across England and process around 500,000 files a month. So we've got a wealth of experience in managing large volumes of data. At the moment, that's generally used for commissioning purposes, but obviously here we're looking to expand that use to research. To bring users to our SNSTE, we'll know we're going to have a data offering which is appealing to a range of end users. So that's from a provider, university and industry partner, because ultimately, while we may focus on some of the provider and university use cases first, industry is very much up there on the agenda. So we're keen to engage with them and develop those models so we can share data safely with them. We plan to use data sets where we can that are already collected. So I think people have mentioned in the chat some of the NHS England commissioning data. So we'd certainly be looking to use that, putting in place the right governance, things like local provider flows, and hopefully establishing some primary care data as well, and with the support of GP practices. But to give that unique value proposition that Mark's talked about, we know we're going to have to supplement this with other health and care data. So we're kind of working to establish what those flows might look like and to develop that data asset. That will need to be proportionate though for kind of providers, but also making sure that it's appealing to users and industry. To do that, we're engaging with a number of groups across the region to define those priority areas. So we're kind of presenting to CIOs later this month and in February as well to work with them to understand the details of that from provider trusts, but also looking to engage researchers. So kind of again on the back of this, we're happy to receive feedback from we'll kind of be going out to certain groups to ask that to establish what those flows might be that are most useful. And then lastly, this is actually a bit of an ask from the group. So it's a really request for volunteers and some sort of some support with this. We really want to establish a researcher user group. We want that to help shape the future of the NENCS and SDE, as we're kind of keen that the tools meet usability and accessibility standards, and we're developing something that researchers want to use and is really useful for them. So we'd like to get a mix of researchers from across the region to talk about things like the kind of user interface, for example. And another thing we're keen to get feedback on fairly early on is the metadata catalogue that we've developed. We haven't confirmed a frequency of meetings yet, but it may be kind of on a case-by-case basis. We kind of call this group up because that'd be really helpful. And I think Catherine's got something she's going to share out later to get interest if people want to join. And we'd be really interested to hear from you and join and sort of set that up. That was everything from me, but I will hand over now to Dr. Chris Plummer.
Thank you very much. My job is to talk through how we want this to work from a clinician, from a researcher perspective, and this is just to reassure you, going to be relatively non-technical in the way that I'm going to present it. So in terms of the current situation, we have our 380 data controllers, as you've heard. We flow a lot of data, routinely collected data from those systems for national reporting purposes and other purposes. The secure data environment will take some of those data and put them into a data repository. And as you've heard, there will be a catalogue, a menu of data that we can use for legitimate research purposes. So once we have individual research questions, individual research projects, they will set up an environment in the SDE where those individual researchers can put their individual data from other bits of the research. But crucially, and this is the unique selling point of SDEs, we'll be able to combine those data with what is routinely collected across the region in the data repository. So that's the view about how this will work and the value, the huge value with the research governance around it that'll bring to clinical research. But of course, we're not the only secure data environment in the UK. And what we will be able to do is to have, as you've heard, some unified data models so that we can, again, with all the appropriate...
Chris, I think you've muted.
Yes, you've accidentally muted, Chris.
Sorry, that was inadvertent. I don't know if you missed that, but so of course we will be able to share data with the right governance with other secure data environments around the UK to get information, particularly about rare diseases, but also about populations where care is delivered in various different locations across the UK. So a real opportunity for sharing not only within the region, but more broadly across the UK. So in terms of how we see this working, and having now, there we go. So how we see this working is, in the first instance, allowing key researchers with data sets that are all ready for research to be able to use those in the secure data environment with all the security and the tools that will allow them to do. And as the data repository becomes populated, we will be allowing those researchers to join up data sets from the data repository and get the benefits of that wider tranche of data from across the region. So we see this as a phased process. We can start with the research projects that have been discussed that already have their data sets, and then add data from across the region. And we already have these proof of principle projects. Admission and AI Multiply have their data sets. They also want to add data from around the region, particularly joining up primary, secondary and tertiary care to answer some very important questions about long-term conditions and multimorbidity. So how does this work? What are the real benefits that we're going to see in terms of clinical care from our SDE and the joining up of the SDEs across the UK? Well, I think the first is the ability to collaborate, to be able to use data that are collected routinely from multiple sources, and to analyse that comprehensively across the whole patient journey, the whole citizen journey, to give new insights into the way that we can answer these very important questions, particularly about the complex clusters of conditions that our patients are increasingly being presenting with. It'll allow us to do clinical trials in new, more efficient ways. We'll be able to look across our region about whether clinical trials proposals are feasible. Are there enough patients with those characteristics? And having done that, to identify individual participants who've agreed to be approached for clinical trials to facilitate that process. And the use of a virtual control arm is a very hot topic throughout early phase clinical research in the UK. It'll allow us to translate the results of that work from precision medicine, particularly trials, to learning health systems within our increasingly highly developed electronic patient record systems, to give the information to clinicians at the front line, that clinical decision support, to make the best decisions possible for patients in real time. The other thing, of course, is wider research uses with observational studies and evaluating how efficiently our health systems function for particular subsets of patients. And there is no other way of doing this other than this wide sharing of these routinely collected data that we've talked about. So that's my summary of where I see this and the value of it from a clinical perspective, and I'll hand back to the team.
Thank you, Chris. So we're kind of bang on schedule, if not slightly ahead, and we're happy to open to question and answers now. I know the chat's been quite vibrant with questions and things. So, Catherine, Sarah, is there any specific questions you'd like to highlight? And
yeah,
by all means, if there's anybody on the panel, sorry, if there's anybody any kind of participants who want to raise their hands, please do so as well. Go on, Catherine.
I've got a couple of questions I've not been able to answer. So one Peter has just posted saying, where data is sought from or shared with other regional SDEs, will further approval from other DACs be necessary?
Have we got Hills Pool on the call? Just to check. I don't think we have. So, so at the moment, we'd envisage it would. Whether we can get to a situation where kind of one DAC can provide that approval, we don't know, but at the moment we'd assume it would involve kind of the DACs relevant to the specific regions. But again, we're kind of following NHS England model on this, so we'll wait to see how that develops.
And I did have another question as well from Stephen Potts. Is this project in addition to or likely to replace the data access environment hospital episode statistics? Didn't know if that might be one for Vicky.
Yeah, I don't know if that's an existing sort of national kind of tool as well. So as part of the programme, there will be, as the regional SNSDs, there will be kind of a national SNSD. So I think the ambition longer term is that the kind of researchers, if they're kind of wanting that, will go to the national SNSD for the research purposes. So I'm not quite sure if it will replace that, to be honest, so we can pick that up and come back to you. But certainly there's an ambition that it will be the SNSDs, and that network will be the kind of point of access for research use. But we'll clarify on that.
I don't think there's any other hands up. I mean, I know some of the questions that were asked was around sort of industry having access as well. We just talked sort of quite briefly in the chat just around the fact that we need to sort of develop the commercial model. So I don't know if you wanted to expand a bit on that.
Yeah, I think it is recognising that obviously industry do play a key role working with kind of healthcare partners in developing new treatments and innovations. So very much kind of there would be an industry role as there is now. What we need to look at is how that access is provided, which one of the values of the SDEs is that we can basically within the healthcare system within our region we have control and can define how that's governed and access. So it's very much there would be kind of industry in line with the kind of projects which take place now and the collaborations, and we just look at kind of how that's governed and the things like the commercial models and things around that. I think an important thing to add is back to this data access by default, is that in effect, we are providing controlled access into data. Data can't be taken out of the environment. It is just providing access through a virtual desktop into the environment. So in effect, we're not distributing data out. We're just providing controlled access through the SDE into subsets of data, which is held there for specific purposes.
I'm just checking what other ones we can pick up on. I mean, I suppose there's, I suppose it's around the governance and all of that. Obviously, that's not sort of operational yet, so we're kind of in this sort of transition state at the moment where we have an SDE, so we can, talk to projects and things. But obviously, we haven't got the data access committee set up. The other question was just around opt-out as well. I know that's something that we've been talking about within the programme team quite a bit at the moment. Around how sort of members of the public would opt out.
So currently you would be using the national data opt-out facility, as we've presented, to be able to get approval centrally from the CAG to be able to develop our research and development data repository for the North East and North Cumbria. We have got to go through what's called a Section 251 application, which we've just started to progress. And one of the feedback we've had from other regions who've been through that is that they can be asked to develop their kind of own opt-out facilities within the specific region, specific to the kind of SNSDE and use for research and development. So, we may have to provide some additional options over and above the national data opt-out to facilitate that, but we have to see what comes out of the Section 251 application.
We've had some more questions posted in the chat as well. So Paul Watson's asked about the documentation for Axiom, which I presume someone might be able to
I've just replied to that, Catherine. So I think the kind of depending on what sort of documentation we mean, I suppose there's kind of user documentation we've got. I know we're going to share with you to pop on the SNSTU website. If it's sort of technical documentation, I think we'd share that kind of with projects as they needed it for applications, for example, on the technical details. But I've just also popped in there as a reassurance in terms of the testing that we undergo and the kind of compliance that Next meets already. But as part of the SNSTU accreditation, there'll be kind of various tests and things we have to go through, and that kind of the platform kind of goes annual security testing as well to sort of check it complies with all those standards.
We have a raised hand as well,
yes,
so
we've got a few hands.
Bring Peter in. Peter Wheatstone.
Yeah, hi there. Thank you. I was delighted to see on one of your first slides that you talked about patient and the public and governance, but also comms. And the point I wanted to ask was, well, more of a point I wanted to make, to be honest. It's all right getting all these national qualifications. It's not the right word, is it? But, you know, a public who doesn't understand the qualification or know it exists or what it does doesn't really help the reassurance angle with the public. So that's why I'm delighted to see the comms. I think they've got an active part to play in terms of creating or communicating case studies of where sharing data has benefited the public, and all the other things that you're doing in language that they can understand and delivering that to the public rather than the public requiring to go onto a particular website. So it's about proactive comms, I think, and that's the point I wanted to stress, that I'm hoping that's what you meant within that one of those first slides.
Yeah, I don't know if I can take that one. So I'm the comms lead on the programme, but we've got a very sort of extensive public engagement strategy. So we've recruited a number of members of the public as public members. So they're sitting on they will sit on the governance. We've already got some on the steering group. They will sit on the data access committee. But that group of people also is helping us with our comms. So we've done some initial sessions with them around messaging, around how we talk to the public. So they're sort of helping us develop the website and all of that sort of thing. So we've done a lot of work with them. We're also doing sort of work in terms of sort of street surveys and understanding what people's understanding of how the data is used, what their expectations are around that. So we've got a really, really comprehensive plan for comms and engagement. And we're kind of not just doing it, you know, I mean, ticky box, oh, well, we went and spoke to 5 people. We've got a really, really comprehensive plan. Not that I would say that's ever happened before, but we've got a really comprehensive plan for doing that. And there will be a big sort of public information campaign around this. So like I say, the work that we're doing at the minute is the initial sort of planning for that. But there will be sort of public information campaign as well that goes alongside.
Great, thank you, Catherine.
Thank you. And we've got another raised hand, Naeem Sumra.
Hello, can you hear me?
We can, Naeem.
Yes, thank you very much. A very nice presentation, so impressive work, Mark, and all the team, including Chris. The question I have is, in Title 2 SD, is the government so
Naeem, the line's quite bad and we've lost you. Do you want to try again?
Funding for FDP, which is a national platform. Can you hear me now? Can you hear me? Sorry.
We're struggling to hear you, Naeem. We can hear you bits.
Can you hear me now?
Do you want to try again, Naeem? Yep, we can hear you now.
Yes, thank you very much. I do apologize. I'm traveling. The question I have is, how do you envisage collaboration between SDs and FDP, which the government has invested quite heavily? So do you see any future collaboration between the two so you can get data nationally and also from the regional SDs for research purposes?
So I'll maybe start. I'll kind of start off with that and then hand over to colleagues as needed. Basically, the SDE and the FDP are very different use cases. So Chris, at the end of his slides, had the scope of the SDEs and the type of projects and use cases they can actually run. And there's a very specific, the NHS England have been very keen to specify that they're outside the scope of FTPs, the Federated Data Platform, which is more around kind of operational use within, for instance, hospitals, for things like kind of patient flow, etc. And crucially underneath that is kind of the kind of legal basis of why the data is collected, and then what it can be used for, which again, there's different legal basis between the Federated Data Platform and the Secure Data Platform. So certainly within North East and North Cumbria, and I think NHS England increasingly, they've been very keen to show the distinction between the two. So whether there's any optimization can take place over time, I think is to be seen. But at the moment, you know, there is a very distinct blue water between the two programs and the types of the use cases for each, and hence the data use for each as well.
Thank you, Mark. That's very kind of you.
We've got quite a few more questions coming in. I don't think we've got any other hands up, have we?
We haven't got any hands.
So using machine learning to build models can be very computationally, intensive. What computational resources will be available for analysis? So I guess there are the tools and things that are on the platform, aren't there? I don't know whether maybe Vicky could.
Yeah, I think we kind of look to scale, as you sort of say. So I think the benefit of it being in the cloud is that it can obviously is scalable to kind of meet those. So that's what we're kind of working on. So we know that the kind of robotics or kind of RAP and those kind of reproducible pipelines are going to be the kind of what a lot of researchers are going to want to do. So I think if we kind of know the basis of that, kind of the specific use case, then kind of please share. But yes, it will kind of look to scale, but obviously then the cost kind of will scale proportionately to that, depending on the number of users and data sets and the kind of length of time that needs to be in place for.
Thanks, Vicky. I've got a question as well around, I suppose it's around governance again, around where sort of projects sit across multiple SDEs or the national SDE, just around sort of how the governance and like applying to access data when it sort of sits across multiple SDEs or the national one.
So the NHS England concept is to have if there's an application for multiple across multiple SDEs, to have what they're initially calling, and I've got a caveat to say this is an initial kind of concierge service, whereby one of the SDEs takes the lead on behalf of the others. Obviously, what NHS England are very keen to avoid is people being kind of passed around different teams and different networks and kind of replicating what can happen now between, say, kind of primary care, secondary care, local authorities, etc., but on a national basis. So there is this concept of a concierge service. Again, we need to work with NHS England to help develop that and see how that will work over time.
Wow, thanks, Mark. There's a question from Graham around sort of information on pricing and fees. I think you'd said before that we're kind of costing things as that we can provide that information now, can't we?
Yeah. So the ambition from NHS England is to have a common pricing model across all 11 regions, and to really create a kind of non-competitive environment, if you like. You know, the regions aren't outdoing each other by price. While that is will be developed, where we've already started looking at a local pricing model for North East and North Cumbria, and we will develop that over the course of this calendar year. We obviously will work very closely with NHS England to be consistent with them, but we've already got a number of requests around pricing. In the interim, as we mentioned earlier, we can provide kind of pricing based on current practice, and that won't set a precedent for a future kind of common pricing model, but we can provide pricing just for interim projects, you know, as they come through now. So any requests, you know, by all means, kind of forward those, and we'll provide interim pricing around those.
Mm-hmm. And I guess for sort of PhD students and things like that, you know, I mean, we'd possibly have different pricing levels, obviously depending on who they are. So yeah, we've had another question about PhDs. This is a really tricky one, a legal one, which I know we haven't got Hills on the call. So I think the question that Petros has raised, how are you planning to remove the reliance on Section 251, which is meant to be a temporary measure and effectively suspending the common law duty of confidentiality? Does the NEC public know and understand the basis of running this SDE? For some others, I think it's just to talk about, obviously there's different legal bases in different areas. I think that might be a question we need to come back to. We can check that with Hills, because she's our IG person, or Leanne, if I'm not sure if Leanne's on the call, but they'll be able to answer that. I think I'm not hanging out on that one. Francis McKay, what role will the public health data have here? Will it be part of the routinely collected data, or is it something separate? Would that be one for Vicky?
Sorry, Catherine, I've missed that one. I was looking at I was looking at an answer from someone else.
Yeah, it's just about the role of so will public health data be included?
Oh, I think I replied to that one, but I mean, yes, definitely. Like if that's something that visit interest, we kind of, it would look that we'd have data across health and care. So I think it's kind of around engagement with the data controllers and then being happy to share that as well. So but thanks for mentioning that, and I suppose we'll kind of consider that based on feedback with others in terms of priorities for that. But yes, definitely we can collect that, because some of that sits within the NHS and some of that will sit within local authorities. So we can pick that up.
So I think that's all the questions that we've had in. I know that Vicky's sort of answered quite a few that have popped up in there.
Yeah,
as well.
I've tried to reply to some as we've gone on.
Yeah.
And if anybody, if there are questions which aren't answered, or people have additional questions, by all means, kind of keep bringing them through, and we'll kind of continue to request those. And any, particularly the one raised about Section 251, we will come back with responses about that post the presentation. So I think we'll draw things to a close there now. We're getting towards 12 o'clock. Obviously, thank you for everybody for attending. We are holding another webinar, the same webinar again in February. If there's specific topics which anybody wants kind of specific webinars about, and noting things like the understanding the technical platform in more detail, etc., we'd be more than keen to look at kind of holding individual more specific webinars going forward. And we will continue with regular webinars beyond the next one in February as well. Happy to come along to talk to individual groups, etc. We have engaged with a number of regional groups. As always, there's many more to engage with, so please get in contact if you'd like us to come and talk to individual groups. And these slides in the presentation will be made available post today. So we'll kind of send the communications out around that. And I would like to just remind as well about the data sets, the initial question about the data sets and what can really help us set apart as a SNSDE kind of within the national network as well. So as program director, again, I'd just like to thank everybody for coming along. It's been really interesting seminar. We've got real kind of opportunity ahead of us, and obviously be really looking forward to working with everybody. And thanks to everybody for coming along, and we'll draw that to a close now. Thank you.